My name is Nancy Chilifia, here to present to you about bipolar disorder. It is a disorder associated with episodes of mood swings ranging from depressive lows to manic highs. Most cases of bipolar disorder are identified in young individuals. The prevalence of bipolar disorder across the world varies from 0.3 to 1.2% by country. Worldwide, an estimated 46 million people in the world had bipolar disorder in 2017 to 2018, with 52% being female and 48% being male, respectively. Mania and hypomania. Mania is abnormally elevated, expansive, or irritable mood. Mania and hypomania are two distinctive types of episodes but have the same symptoms. Mania is more severe than hypomania and causes more noticeable problems in people's daily activities. Here are the symptoms. 1. Abnormal heartbeat. 2. Increased activity, energy, or agitation. 3. Exaggerated sense of well-being and self-confidence. 4. Decreased need for sleep. 5. Unusual talkativeness. 6. Distractibility. 7. Poor decision-making. Depression. Depression is a disorder which may be characterized by feeling of sadness, loss, or anger that interferes with the patient's daily activities. It is associated with the following symptoms. 1. Deep sadness. 2. Feeling of worthlessness or excessive inappropriate guilt. 3. Loss of energy. 4. Decreased ability to think or concentrate. 5. Lack of interest in activities they once enjoyed. 6. Periods of too little sleep or too much sleep. 7. Suicidal thoughts. Bipolar 1 disorder, or also known as bipolar disorder 1. Associated with manic episodes, which may be followed by hypomanic or major depressive episodes. In some instances, mania may trigger a break from reality, also known as psychosis. Bipolar 2 disorder, also associated with one major depressive episode and at least one hypomanic episode, but never a manic episode. Depressed for longer periods, which may cause impairment. Here are the causes. The causes of bipolar disorder are known, but the different factors may be involved. 1. Biological factors. 2. Genetic factors. Factors that may increase the risk of developing bipolar disorder or act as a trigger for the first episode include 1. Having a first-degree relative, such as a parent or a sibling living with bipolar disorder. 2. Periods of high stress. 3. Drug and alcohol abuse. Diagnosis. In order to diagnose the problem at hand, one has to undergo different evaluations, which may be arranged in the following order. 1. Psychiatric assessment. 2. Physical examination conducted by your doctor. 3. Mood charting. 4. Criteria for bipolar disorder, also known as DSM-5. Treatment. Different medical personnel such as psychiatrists, psychologists, social workers, and psychiatric nurses are involved in treatment plans, which involves the following. 1. Medication. One is required to take medication to balance out their moods, such as mood stabilizers and so on. 2. Psychological counseling, such as psychotherapy, to control their symptoms. 3. Educational and support groups. 4. Hospitalization. The doctor may recommend hospitalization if one is behaving dangerously, feeling suicidal, or becomes detached from the world, as I said earlier on, which is also known as psychosis. Thank you for watching this video.